Thank you so much for that intro, Kimbra, and thank you so much, everyone in the audience for tuning in. You may have seen, I think a poll was just released so that we can get a sense on who's actually joining us this evening. It'll be really helpful for me as well, especially as we go on to kind of know who's in the audience and what kind of perspectives people have that are listening. But what I kind of plan to do today is just kind of talk through briefly the startup journey and share a little bit about my background and our co-founders' backgrounds to give a sense of how this all got started from our origins in College Park to where we are now. And then, like Kimbra mentioned, I'll kind of touch on where the business is now, who we're working with, and what kind of services or solutions that we're actually offering, and how much of a difference it's actually making for advancing healthcare and digitizing the healthcare experience. So with all that being said, I started at the University of Maryland, College Park. I grew up in Maryland. I'm from Maryland. I started in 2011 and graduated in 2015 with 2 degrees, the neurobio major as well as finance degree. And 2 of my close friends in undergrad ultimately came to be 2 of the other co-founders of Clearstep, where there are 4 total. And one was Bilal Naved. Bilal was a bioengineer major at UMD, graduated in 2015, and then went on to do his MD PhD at Northwestern, which he is in the middle of / on a break from kind of continuing to build the company. And then our third co-founder from UMD, Peter Garber, was also a finance major, and after undergrad went on to Twitter to work in sales, marketing, and design. So we all kind of started at College Park, and one of the things that I think is really important, and we talk all the time about our team, but one of the big challenges when you start a company is having the right talent around you to form a strong founding team. And I was very fortunate to kind of have that with 2 of my fellow Terps, and then one of our other friends who went to Penn and was relatively early at Dropbox. He's our CTO now. We had really talented people in our network that actually filled really critical gaps to be able to get the company off the ground and form the foundation of it. And I think that's critically important, and I think that's something that I didn't even realize was happening when I was at Maryland, and I feel like if I made a conscious effort, we could even have leveraged it further. So just a small tidbit, giving some recognition to the UMD community and being able to be surrounded by really awesome people who went on to become really important in getting the company to where it is and getting it off the ground. So to kind of get to how the company got started, after undergrad, throughout undergrad, I was pretty intent on also going to medical school, and had taken the MCAT, was getting ready to apply to med schools, and kind of at the last second decided to. Initially the thought being I'll go take some gap years and kind of leverage this finance degree that I spent all this time doing for, at that time, seemed like seemingly no good reason, if really I was passionate about going into academic medicine, which I was. But I decided to kind of take some gap years initially to learn more about the industry, leverage my business degree, and kind of use that to benefit my career in medicine later on. That was at least initially the plan. And what kind of ended up happening was, well, one other thing I'll mention is that throughout undergrad, I did a lot of research bench basic science research as well as some clinical research at Hopkins in Baltimore. And actually Bilal did the same. And so Bilal and I were constantly commuting back and forth, spending our summers in Baltimore and commuting back and forth between College Park and the Hopkins Medical School campus. The reason I call this out is because Bilal and I both reflect on how really critically important these early experiences were for each of ourselves in getting a foundation in innovation and using the scientific method to discover new things, to kind of be at the cutting edge, and really importantly to communicate our ideas and our findings and our vision and direction really clearly and crisply, which I really believe research does. And so we give a lot of credit to where we are in our careers, to the early days and the exposure we got doing research in undergrad. So again, I call that out too, knowing that there may be students on and who may be interested in research. And I think to say at the outset, I think two of the most important things that I did in undergrad that have been critical for developing the skill set needed to be a startup founder for a startup that's venture backed, that VCs are putting millions of dollars into, and kind of trusting you to build the future. A lot of the skill sets, the foundational skill sets that myself and the founding team developed to be able to actually do that came out of, I think, two main areas in undergrad. One, research, and two, building a student organization. Bilal and I at the University of Maryland had started Humanity First, which is still running, is a student-run nonprofit on campus. And that was really important too, to build foundational skill sets in communication and marketing and recruiting and, setting a vision, having a company structure. All that was really important. So I tell people who are in undergrad now that getting involved in research and getting involved in student organizations and trying to be in leadership positions there, or start your own if you can identify a void or something that doesn't exist, is really, really critical. It can be really, game changing for future opportunities and your ability to get in front of a room and speak, which is, ultimately the art of building a startup sometimes really comes down to how good of a storyteller you are and how well you can kind of paint a vision, especially early on when you barely have a product and you have no customers and you're trying to get, venture funding. Getting to building the company, post undergrad, like I mentioned, post research, went into healthcare consulting to try to get this industry perspective. And in consulting, I was working in strategy and analytics for a company called Accenture, which probably a lot of people are familiar with. I specifically worked in healthcare. So I was working with biotech companies, pharma companies, some health insurers, some health systems on various strategic initiatives that they had, or analytics problems, data problems that they were trying to solve, and that experience gave me a really great bird's eye view on healthcare and on the industry and what's happening at the macro level. What kind of what I think also to the previous points I was just making, what facilitated some early success in the consulting world was, again, the background that came from research, where working consulting, you're solving these big problems often that the companies are hiring consultants to handle because they don't want to or they can't, and so these challenges are big, and being able to approach even these kind of industry scale macro level problems with the scientific method and the same process you would take to do an experiment, roughly, at least in terms of how you think about it, was really important. It really made me a better consultant, I think. And similarly, having run the student organization, the ability to communicate and be good at emails and be able to represent the company well in meetings was really important. And ultimately those things, again, helped me get on really cool teams at Accenture. And the very last team that I was a part of for about 9 months before I left and started the company with Bilal was a team that was working on, I was working directly with, a lady who ran a $4 billion portfolio for the company. And we were trying to create a new vertical, you would call it, or a new kind of focus or space in the firm for digital health. And through that initiative, I was able to work and talk directly to some of the biggest tech companies in the country, some of the biggest consumer-focused retail brands in the country that were trying to innovate in healthcare. And that gave me a really interesting perspective on how technology companies were looking at innovating in healthcare and where kind of the areas of opportunity were. So that ultimately it planted a lot of the early seeds for Clearstep, where I was kind of seeing these tech companies talk a lot about AI diagnostics, AI triage, AI care navigation, and what better digital experiences that can help people get to the right level of care. What kind of potential that those experiences really had to offer the industry in terms of saving money for insurers on avoiding spending money on unnecessary ER visits, for example, or benefiting hospitals and health systems by making it easier for their patients and members to know exactly what care they need at the right time and be able to access it more efficiently. So it was through these industry experiences in consulting that I kind of was seeing where novel technologies could significantly impact healthcare organizations. But I also had the realization that true innovation in terms of being risky and starting something brand new that may or may not work wasn't really going to come from these big existing industry players, and particularly not from the consulting world, which isn't really known for being super innovative necessarily. And as we kind of had these realizations or as I had these realizations is when Bilal and I, since we kept up so much, and kind of realized that we could start something that actually accomplished the goals or met what the market opportunity was. Bilal had the perfect kind of micro level experiences that married well with kind of the macro observations that I was seeing at the industry level, where Bilal, as at the time an early MD PhD student, was experiencing, even as a medical trainee, his network of family and friends contacting him pretty frequently for advice on what to do for X, Y, and Z symptom. Him in early opportunities and kind of shadowing and clinical work was witnessing kind of firsthand what we all know to be true: unnecessary ED spend, people coming to the ER when they really shouldn't be there, or people having to jump through 3 or 4 hoops to finally get in front of the doc that they should have been able to see from the beginning. All these kind of inefficiencies in care routing, Bilal was kind of seeing on the front lines. And so we kind of put our heads together to realize that the algorithms that determine triage and where someone should seek care are generally pretty well established and are pretty rules based in terms of when someone presents with X, Y, and Z symptoms, what should they actually do? That's like embedded in the minds of every clinician in a pretty algorithmic way. And so we started exploring avenues to be able to get access to this kind of data in a way that we could actually start building the company. And we started doing this all part-time. Bilal was in school. I was working consulting. But we spent after realizing kind of there is a real opportunity here. Health systems and insurers are thinking about technology like this for the future. After we kind of validated that there's generally a market opportunity, actually, that was really first step. Second step, and I'll get to what I was just going to say, but the second step really was looking at what solutions are currently there. And this is, for any students that are interested in entrepreneurship, really kind of the general process is like, one, cool, you have an idea. Is there a market big enough for this? Is there a big enough problem that this solution will solve that is going to be worth someone paying a lot of money for it? And generally, you know, these should be huge numbers, right? Like for us, it's that, you know, there's this $500 billion of you know, potential missed opportunities to deliver care at the right time, in the right place. And there's all sorts of ways you kind of justify and get to these numbers that I won't really get into. But, you know, venture capitalists will only back a company that they think there's a way, a plausible way for the company to get to, you know, $1 billion valuation. That's the lens by which VCs look at companies. So, you know, step one after having ideas, like, is there a big enough market for this where you could have 1,000 customers paying you X, or if it's a direct to consumer company, hundreds or thousands or millions of people, like what are the economics of this and how big can this company get? That's like step one. But then what Bilal and I started doing beyond that, before, again, anyone left their jobs, was to really study what currently existed. And so doing a ton of, you know, reviews online, just like figuring out, you know, what are people currently using for triage and virtual triage. I'm going through hundreds of companies to understand what they do, to see whether someone actually is or isn't doing what we had the idea for. And for us, that kind of yielded the realization that, you know, no one, or at least very few, were even moving in the direction of what we wanted to do, which was, you know, as Kimbra described in the intro, you know, providing a digital means for people to understand what care is necessary, and how to get it, and making that really easy, like really easy, the way it is to, you know, order an Uber or order food, not to make healthcare trivial, but it really should be a couple clicks on your phone to get from, do I need care? If so, what care? Who's in network? How much might it cost? And who can I go to? When can I go? Can I book it online, or can I launch a virtual visit? No one was really supporting this end-to-end experience, and in a way that, you know, could be sold to health systems, or hospitals or health insurers. So, you know, post validating that, you know, big market opportunity, you know, big, not a saturated market, like no one's really working on the exact right solution the way we see it. After that, it was like, okay, cool, let's start building the technology out. Let's start finding, you know, the data that we need to start building technology. Let's get some engineers to work on this with us. And so we started doing those things simultaneously, again, just part-time while we were working our day jobs. And two big things happened. One, we recruited Dave as our CTO and co-founder. And like I mentioned, Dave went to Wooten and is from Montgomery County, went to Penn, and like I mentioned, was a really brilliant engineer at Dropbox. And we recruited Dave to be our co-founder and work on building the technology with us, which is obviously really important. Neither Bilal nor I were software engineers or had that background, so we needed to fill that void, which Dave did perfectly. And then, you know, simultaneously recruiting Dave, we kind of leveraged Bilal's Northwestern network to be able to find kind of the original writers of these triage protocols that are used in like virtually all nurse call centers across the country. So Dr. Barton Schmidt and Dr. David Thompson, you know, originally wrote these protocols that are used in these nurse call centers. And so we ended up striking a relationship with initially one and then both of them to be able to get access to this data that nurses were trained on and that textbooks have been written based off of to support triage. And it was really, really critical for us because that, you know, ultimately became very differentiating for the company that we were kind of working with these, you know, some of the forefathers of like triage and of call center triage. And once we had this foundation built, you know, we had, you know, Bilal with a clinical background, clinical network, myself with an industry background, Dave with a technology background, and Peter, who was also a Maryland grad who was working at Twitter, to do, you know, our user experience and user design. We really just started building while simultaneously trying to sell the software. We ended up building an initial prototype pretty quickly. This being, the end of 2018, a little under 2 years ago, is when we had the initial kind of prototypes wired up and sellable. We got an initial customer pretty quickly, and then we kind of found a bit of a lull in getting customers. Although we were more focused on fundraising, and we started raising a couple $100,000 from angels in our networks. And if there are questions or interest in the fundraising process and how exactly we did that, happy to dive into that in a little bit more detail. But we started raising some money, and there are kind of a couple pivotal events for us that really helped establish us as a real company. Two main things. One was we were accepted into United Healthcare's Accelerator program, which is looks like there actually was a question about raising money, which maybe I'll kind of circle back to a bit later, but we were accepted into the United Healthcare Accelerator program, which was the first year they'd ever done anything like this. They just accepted their second cohort right now, but it was powered by an accelerator called Techstars. And for people that aren't familiar with what accelerator programs are, there are a couple very well-known accelerator programs. One is called Y Combinator, the letter Y Combinator, and another is called Techstars. And Y Combinator, they have a pretty standard process. They'll invest, $120,000 into a company. They'll take 6% for that initial very early, pre-seed, seed investment. And it'll give you a lot of resources to help you grow and establish yourself and give you inroads to customers and discounted rates to technologies and things like that. And some of the biggest companies, have come out of, Y Combinator and these accelerators, Dropbox, Reddit, Airbnb, PillPack was the Techstars company, but hundreds of other really, really well-known companies have come from primarily two main big accelerators, Y Combinator and Techstars. And so we got into Techstars and specifically the United Healthcare Accelerator for Techstars. And so we kind of relocated to Minneapolis, last fall, about a year ago, exactly a year ago. We kind of moved the company to Minneapolis for 3 months, where United Healthcare is based, and started, really working under kind of the home of one of the biggest, or the biggest healthcare company in the world, and the biggest insurer in the country or in the world. And that was really kind of transformative for us too, because it opened up such a big network to us, and such great insight into the product we were developing and how to position it, and what exactly the go-to-market strategy should be, and what kind of product features needed to be a part of it to make it compelling for healthcare organizations to actually buy. And so that was really important for the trajectory of the company, kind of going through that accelerator. And then coming into the early part of this year, we had a lot of wind behind us, coming out of the United Healthcare Accelerator, and we started raising some more capital to continue to expand the team, and then COVID happened, and this was we were very fortunate to be in a position where we had already been building a technology that was meant to solve what has become a really critical problem: getting people to the right point of care as efficiently as possible, digitally, without them having to talk to anyone, so that you have people who really do need to go to the hospital and do need to go to the ER going to the ER, and that you have people who do not and who could just use a virtual visit, or go to a retail clinic or a Walgreens or just pick up some over-the-counter meds or whatever it might be. Those people are doing that and not going to the hospital. This became such an acute need for the healthcare industry, and it was something that we foresaw as being something really important, but we couldn't have anticipated the speed to which things accelerated for us. So at the beginning of this year, we had two customer implementations, making a pretty modest amount, monthly, to landing some really, really big customers over the first 8 or 9 months of this year, including United Healthcare, CVS Health, Doctor on Demand, Baycare Health, Hartford Healthcare, and a couple others. So pretty big industry names and industry players, because partly we had the right product at the right time, partly because we played it right early on in getting access to the right data and building the technology foundationally the best way we could in the most clinically relevant way that we possibly could. And so yeah, throughout all of this, we've raised a little over $1 million, like $1.3 million. But despite that, somewhat, relatively small amount of funding, we have some really, really great backers and investors in the company. Probably the foremost being one, Techstars and United Healthcare, like I mentioned, then another called RRE, a really big fund in New York that is one of the most well-known funds on the East Coast and has invested and helped build and scale companies like Venmo and Business Insider and a bunch of others. So this year has been really transformative for us with growing our technology, growing our customer base with really solid early customers, and growing our user base. We've had probably around 300,000 or 400,000 uses of the technology this year alone, and are really seeing through user feedback that we're really solving the problem for people. We're making it much, much easier for people to actually identify and find the right care at the right time. I do want to leave some time for questions in maybe 10 minutes or so. I thought it might be worth it to actually just share what the technology actually looks like and how it works, so that people can get a true sense of it. And then I can also briefly kind of speak to how we view the next few months and the next year, and kind of what's on the horizon for us, and then would love to open it up for questions. And I already know there's one around fundraising. So I will share my screen so that I can actually just showcase the technology, and hopefully just give me 1 second. Cool. Are you guys seeing this like CVS Health page? Just if one of the other panelists could just confirm that you can see the screen. Yes, no.
Yes,
Kimbra or Abby?
Yes.
Okay, awesome. Great. Wonderful. So Clearstep is, I kind of alluded to a B2B company, a business-to-business company. We sell our software to other businesses. We don't go direct to consumer. We aren't trying to just get people funneled onto the clearstep.health site and use our symptom checker there. We provide software and technology for other healthcare organizations to use. So let me show you actually what is kind of right now in just some early beta testing with CVS, but will be available from CVS Health's main websites over the coming months. But if you go to cvscare.com, you kind of this will, again, like I mentioned, present to a broad user population via cvshealth.com. But a user is prompted, to help me find the right care, and that will load this experience, which is powered by Clearstep, powered by us, and you can see it in the domain name that this is a clearstep.health domain, but it's white labeled, as it's called, for CVS. And a user is able to search, their symptoms in free text. I have a fever and a runny nose. They're able to answer on behalf of someone else, and we'll change all the pronouns, or you can ask on behalf of your children as a result. And you're kind of prompted to go through this chat and this dialogue where we are kind of drilling down into your symptoms to try to understand their acuity, what possible causes of the symptoms might be, and most importantly, what your next steps should be. Importantly, as soon as we know if it's acute, if it's going to be an ER recommendation, if someone searches, crushing chest pain, 10 out of 10, we don't continue asking questions through the chatbot. We just kind of directly triage them to the ER. But in a case like this, where pretty non-acute symptoms, we'll kind of go through a 7 to 10 question chat. And we see really compelling completion rates. 90% of users who start the Clearstep experience finish, which is really, really high for kind of digital engagement technology. But when you get to the end, Clearstep recommends, a possible next step for care. In this case, you should see or talk to your doctor today. You can put in your zip code, select whether or not you have health insurance or not, which will kind of filter some of these results. And then you're kind of featured, possible next steps for care. And with our customers, we kind of personalize, what the user sees when they click on these expandable windows to what is in the customer's care ecosystem. So, we also work with Hartford Healthcare. And so when you go through Hartford Healthcare's COVID screener, you're going to, at the end, see resources for care within the Hartford Healthcare ecosystem. And so same with CVS, where now you can go launch a virtual visit or, go to a Minute Clinic. And here right now, we're just kind of linking to a page where you can go schedule the appointment, but we're actually working on the next iteration of this where you'll actually see all of the live availabilities right here in this interface, and you'll be able to click through and actually book an appointment. So, that's kind of functionality that we're going after, where it's, really clear results on what you should do, options for care, some basic price level information, although this is expanding too, where we're actually going to be able, if you take a picture of your insurance card, we'll actually be able to contact your insurer and get back what your copays will be and where you stand on your insurance to give you an actual price estimate, not just these dollar signs on what the care might actually cost you. And then we provide things like home care advice, what you should do to take care of yourself at home, what are relevant over-the-counter meds, where's your nearest pharmacy, things you can do to take care of your symptoms, like, in this case, salt water for nasal rinses and how to make it. So this is what we are offering to our customers right now, and we're continuing to expand and grow the product and the solution, and ultimately, like I had mentioned early on, like the broad goal is let's make it really, really easy for healthcare consumers to know if they need to access care, if so, what care, what are actual options for that care, what's in network and covered by their insurance, how much might things cost, and can I actually book the appointments? This is bringing together such fragmented pieces of the healthcare ecosystem into one cohesive user experience from start to finish of knowing you might need care to actually accessing care. And that's to kind of touch on what I mentioned I would at the end of my very long monologue is what is kind of the future of care or for Clearstep, and really we think that this kind of experience that I just showed will become really a standard channel by which people access care. Right now, we're just in a fledgling state of what this could actually be. But if every hospital and every health system has a way by which you can go on their website or you can access a page sponsored by the system or the insurer, you can do things like search for what's bothering you or the type of care you need, go through and get really personalized, tailored results for how much things will cost you and what's clinically relevant to you, considering demographic factors, et cetera. Ultimately, getting to a level where we can very accurately predict what kind of services the doctor is going to provide, what kind of exams or imaging or tests you might actually need, and how much those things will cost to give you an overall estimate of pricing, leading into booking the care. With every health system or every hospital in the country, like that is completely transformative to how people are able to access healthcare information and ultimately access the right care at the right time. And there are already a bunch of different product directions that this is going into as well. How do we manage long-term care needs, chronic care conditions via these kind of chat AI-based models as well? So there's a ton of potential. The space right now is really buzzing. There's a lot of investment dollars or VC dollars going into digital health, and we, like I said, are fortunate to have been in a position where through so much suffering really across the world, and suffering on other startups, a lot of startups have been bled dry over the last few months. We've been really fortunate to have something of value that we can offer to customers and to users and patients across the country. And we think that wave is really going to continue, and it isn't even just a wave. It's really a paradigm shift in what in how healthcare organizations are thinking about digitally engaging with patients. So it's really exciting. We're going to be out probably raising a much more significant round of financing early next year. And continue to really dramatically expand our team and expand our footprint. And it's been really exciting to see kind of how Clearstep has been getting recognized in the press and the media over this year, and the kind of thought leadership that we've been that we've had the privilege of kind of driving forward in the space. So I hope that this story was relevant, or helped give people a sense of what it's like to start a company and get a company off the ground. But I want to say right here, and I'll repeat at the end, I'm always happy to engage with the UMD community and other people who want feedback or thoughts on starting a company, or just advice or whatever it might be.